I'm Dr. Martin Rutherford, certified functional medicine practitioner and chiropractor.
Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractor.
And the title of today's No BS series is?
Post Concussion Syndrome, Cutting Through the BS.
Okay. And there's a lot of BS out there on post concussion syndrome as far as we've been able to see. So post concussion syndrome has become a popular topic over the last couple of years. Thank you to the NFL and thank you to the concussion movie that came out, and thanks to CTE, which is something Dr. Gates will probably talk to you about a little bit later. And we see a lot of concussions, and we're going to answer several of the questions that you might have relative to your own condition or the condition of yourself or a loved one relative to concussion. Like, for example,
so many of you are told that you're normal, that your MRI tests are normal, that your CT scans are normal, yet you continue to have post-concussion symptoms, even though all the tests are coming back that you're just fine. And this is very confusing for a lot of patients out there suffering with these problems. Making matters worse, now anytime you have a condition that may be involved with litigation, so we're talking about the NFL issues, car accident issues where concussions are at play, then it comes under intense scrutiny, because what they're finding in the literature is that individuals, for example, who have surgeries or who have infections or who have just a trauma not to the head may have very similar symptoms to you. And because there's not one universal lab finding or MRI scan, then they're told that basically post-concussion syndrome really doesn't exist.
Right, and post-concussion syndrome definitely does exist. Myself, I used to testify in court semi-regularly on these concussions after personal injury cases, after rear end, cervical acceleration, deceleration, whiplash cases, and the car would have no dent in it. The person would not have had their head hit through the windshield. There was no external injury. All the tests were normal, but the person has dizziness, they had nausea, they had vomiting, they had sensitivity to light, sensitivity to sound. And we struggled to be able to try to present that, look, this patient is not faking it, this is for real, and it was a challenge these days. But the data now is accumulating rather rapidly as to the fact that there is post-concussion syndrome. We'll be talking about this. We'll be talking about why that tummy ache that you might have developed shortly after your concussion could be related to this. We might be talking about why I believe your studies, your research has indicated that somewhere between 5 and 15% of concussion patients actually develop post-concussion syndrome. We'll be talking about why, if you have these symptoms and you're watching this, why you're one of the people who has developed these symptoms versus people who have not developed these symptoms, who have had a clear concussive force to their head. So this should be pretty informative. There's a lot of different people out there with a lot of different agendas relative to concussion, as to saying maybe why they think you don't have one would be the ones that we're more addressing in our Cutting Through the BS series. And if you're one of those, or if you know somebody who is one of those, I think this is going to be a very valuable presentation for you to watch.
Yeah, next we're going to go into your consultation room. You're going to talk to the patients out there and kind of go over some of the common things that you hear them going through relative to their concussion protocol and their concussion workup, so to speak, and their diagnostic dilemmas.
Okay. Let's do that.
We'll go to that next.
Right.
So we're here in the consultation room with Dr. Rutherford, and I'm going to pose as the patient, so to speak, in this scenario, going through some of the things that maybe you have gone through, because we've heard the gamut of the stories of patients coming in with seemingly trivial head injuries that are not trivial, patients who get hit in the head to where it doesn't fracture the skull, let's say with a bucket or with a tree branch, or they are leaning under, making a bed under a bunk bed, and they stand up and they hit their head. And then forever they're not the same, or they're in a car accident. And so these are the stories we hear coming into us, and we want to kind of go through the consultation aspect of what we commonly see in this room. After this, we'll go into more of the nitty-gritty details of post-concussion syndrome, imaging, lab tests, things of that nature. But right now, why don't you go into, Doc, what you hear in here. If I'm the concussion patient coming in, I don't understand how, I hit my head and now my life is not the same.
Okay, and that's the whole idea. The whole idea of the consultation, and this is the no BS series. Okay, we're trying to cut through all the stuff that you've heard that maybe is creating confusion, stopping you from going to find care, going to doctor after doctor, and so you're probably also looking to get some information on how do I get better. And one of the ways you get better is to have somebody who understands concussion ask the proper questions in the history, and a lot of times the history can tell you a lot about the severity of the concussion. Again, I think Dr. Gates's research has indicated that somewhere between 85 and 90% of people who have concussions never get post-concussion syndrome.
It's a very significant percentage, yeah.
Yeah, so like 5 to 15% actually get it. So why are you the one who gets it? And that's really what I'm usually digging for around here, because the answer to that question is frequently the answer to you getting better. All right, so as Dr. Gates is going to explain in much, much greater detail, they're coming down to the inflammatory aspects of the physiology of concussion being the perpetuating factor. And a lot of you are out there going, well, I knew that. I knew inflammation was the cause of everything like 20 years ago. I was taking my noni juice and all that type of stuff. But you need to get much, much more specific than that, and you need to get enormously more educated than that. So looking for, why is that person here? Okay, they're here because they have a concussion. The first part of doing a consultation, usually by the time the patient's sitting here, they're confused. They've been to doctors, they've had the negative MRIs, as Dr. Gates just got done saying, and they've been told nothing's wrong with them, but they know something's wrong with them. I talked to somebody just a couple of days ago, and they're out of work, and they've been out of work, and they had to cancel all of their wedding planner, and they had to cancel all of their wedding photos and all this stuff, and talk about perpetuating a stressful, inflammatory situation. So the person knows that they have a problem, and I generally am going to understand that they aren't here just, because they have nothing better to do with their time. So, a history as to what happened can be helpful. When I was doing more of the motor vehicle injuries, personal injury type of thing, when it was a real industry where people actually could get a proper defense and be covered if they were really injured, which isn't particularly the case today, you would want to know, okay, what happened, how soon after the injury, if you got hit in the head with what was the one that you used, the loader, or if you got hit in the head with a tree, or if you got hit from behind. A classic one that I was involved with was the patient was hit by a car, they were sitting in their car, they were hit, their bumper wasn't even damaged, they didn't hit the windshield, their head snapped back maybe, they didn't feel that bad in the beginning, or right when it occurred. They didn't go to the hospital until 10 days later. They suddenly developed these headaches a couple of hours later, and then it's off to the races. Next thing you know, the person has dizziness and vertigo and nausea, and they're getting light sensitivity and sound sensitivity, and all the tests were normal. So this is a patient who usually shows up in here. And so we kind of walk through that whole scenario, really frankly, just to try to help the patient to understand that they're not crazy. Understand also, at that point, the patient is usually incredibly stressed because their life has changed to some degree. They're vomiting, their adrenal glands are vomiting out stress hormones because they don't know where this is going. Everybody's telling them that there's nothing wrong with it. The insurance companies are telling them, if they're involved, are telling them that they're crazy. And they're upset because they know that they're not trying to be, a person who's taking advantage of a situation. They just want to be told what's wrong with them and fixed. And so the stress part that stress part is clearly a part of perpetuating the chronic post-concussion syndrome symptoms. But more than that, what we're looking for is, for example, I'm looking for, one of the first questions I'll ask is, how's your stomach? How's your intestines? How's your bowels? And most patients will say, shortly afterwards, within immediately to like a month afterwards, to a significant number of patients are gonna experience a breakdown in their gut. And Dr. Gates will go into that into more detail as to exactly what the mechanisms are in that. But that breakdown of the gut now can perpetuate inflammation. There's that inflammation. Can start perpetuating that inflammation that is going to feed back to a probable blood-brain barrier that's broken. Go through that. Dr. Gates is going to explain that a little bit more in a few minutes. And then that's going to dictate person's symptoms along with the severity of the concussion and where your damage was. That's going to perpetuate the severity or the length maybe of your non-recovery. And so a lot of questions in a concussion history should go directly to what's happening in your gut. The other things that we will ask in this history, and it's interesting. We were talking briefly before we walked in here. It's interesting. I'm usually looking for the issues that may have made that patient the compromised host, the compromised patient that was going to develop a post-concussion syndrome versus the 85% of the people who are not going to develop post-concussion syndrome. And usually those are stressed. Maybe the person was already chronically stressed. Maybe they're already in fight, flight, post-traumatic stress syndrome, something along those lines. Maybe they already had a bad gut that left them more compromised. One of the things that Dr. Yates mentioned to me before we walked in here was, and this is not documented in the literature, okay? So I think it's okay that we say it because this is what we do for a living and we see it all the time. Probably upwards as close to 90% of our patients, our patient population, and our patient population is chronic pain. It's people who walk in here and they have chronic pain and they won't go away, post-concussion syndrome. And so up to 90% of these people develop autoimmune problems. I go back to when I was doing the car injury case. And sometimes we would get a patient that would come in with a seemingly mild whiplash, if you will. And maybe they were all a little bit lightheaded and forgetting how, they went into the room and why they went into the room. And these are questions that we would ask to try to figure out the severity of what the patient. Have you gone in the room? Do you remember who you are? Do you get lightheaded? Are people telling you that you're repeating yourself? A lot of people, most people get those symptoms and then they go away. The post-concussion syndrome patient, they don't go away. And so we go into those symptoms. But the point I was going to make is that is also the patient there was also that patient that came in and they had maybe a mildly seeming whiplash and or mild concussion syndromes. They were just, as they would say, I just felt a little dingy for a couple of days. And in the end, what would happen is to some of these patients is they would start to get worse. The area would get tender, their concussion syndromes would get worse, and there was no seemingly obvious reason as to why that would be. This was a while ago when I was doing this. And in retrospect, a lot of those patients either already had an autoimmune problem that had been exacerbated and or the immune inflammation from the concussion had probably, and I'm using these terms very carefully because the research isn't there on this yet, this is just what we've seen, has probably caused an immune response against something. Most of the time it seemed to be like their thyroid or their cerebellum or their intestines. And this is something that we see regularly. So there's a little nugget that we're sharing with you because this is something we've seen. And we can't say it's in the literature, there's not going to be any attached research to it. But be mindful of this. We're trying to give you the data that we understand that's going to maybe help you be ahead of the curve on getting better on your own, or like on going into somebody and asking the right questions during the consultation, which our consultation usually takes like about 45 minutes to an hour. Most of you go in and it's like 5 minutes, and you can't really figure out what's going on in 5 minutes. So those are the main things. So I'll usually ask, have you had a thyroid problem? Have you had an autoimmune problem before? Are you getting dizziness and vertigo? Are you getting light sensitive all of a sudden? These are the things that somebody should be asking you. Basically, are you getting digestive bowel problems that you didn't have before? Have you gone into depression? Are you getting more angry? Are you getting short-tempered all of a sudden now, just for no reason whatsoever? Is your balance getting off? And these can give a lot of insight to the examining doctor as to correlate those symptoms with what that doctor is going to find in your exam. Because if you've come here, you've usually got a normal MRI, a normal CAT scan. All my electrodiagnostics were normal. Everybody's told me everything's fine, but it's it's a year and a half later, and I'm not feeling good, and I'm sick, and I can't work, and these types of things. So in general, history should cover those issues. How were you hit? How did you get it? Where was the hit? Those are the obvious questions, and I think those are questions you're asked regularly. Then once all of the testing is negative, now there's a problem. Because if all the testing is negative and your symptoms don't go away in a couple of days or a month, they're probably not going to go away, and you're probably not going to get answers until you get these other questions asked. Were you a compromised host? I mean, there's so many things you can ask. I'm trying to give you the idea. I said to Dr. Gates, blood sugar. You know, if your blood sugar goes down, you get irritable and shaky because you have low blood sugar. That's your brain. Okay, that's your frontal lobe not getting enough sugar, and that's also inflammatory. So if you've already had that, and now you have a post-concussion syndrome, that can perpetuate inflammation. So you start looking in the history for anything in your physiology that can violate the now broken blood-brain barrier, which Dr. Gates will talk to you about, and get into your brain and perpetuate inflammatory imbalances. And there are a lot of things, and nobody looks for those. And that's the problem. Everybody's like, well, you had a concussion, there it is, it's right here, we should look at that and not look at anything else.
Mm-hmm. I agree. I think you hit all the points.
Okay. Yeah. If he says I hit all the points, then I hit all the points. So what we'll do now, so again, and we're just trying to emphasize here, one of the things that's missing in general in healthcare today is a legitimate history and exam, and there's a lot of reasons for that, and I guess we could get into those, but it has a lot to do with what insurance companies are going to cover, what they're not going to cover. So if the doctors aren't going to get covered for doing a 90-minute exam, or they're not going to do an exam. If the doctors aren't going to get covered for giving you a certain treatment, they're not going to bother to give you that certain treatment. It's just the way it is. It's not that they're bad people, that's the way it is. But these things require a thorough history, not just to figure out if you have it, but where you have it, and then that history is should sync with the examination procedures that an astute diagnostic, hopefully neurologist or emergency room doctor, someone like that, would do for you. And so what we're going to do now is we're going to go in and we're going to talk a little bit about in and around maybe some of the exam findings, and we're going to talk about, Dr. Gates is going to talk about some stuff coming out relative to lab tests, relative to determining, other ways of determining now, do you have a concussion, and correlate that with your history, and then other newer tests that are coming out that will say you have a concussion even though your MRI is normal and your CAT scan is normal and your nerve conduction velocity is normal. So why don't we go into the exam room and talk about a lot more specifically about many of the topics that we just approached in how we would go about taking your history. Okay. So now we're going to talk more about the actual physiology of what's happening to you. If you're watching this and you have post-concussion syndrome symptoms, we're going to talk about the specifics of why they're there, maybe what they are, and then we'll go into, after that, some of the procedures as to how to determine what areas of the brain are involved, the severity of it, some testing, and how you would go about actually starting to get a grip and get a hold on getting that turned around and starting to feel like a normal human being again. So the physiology of concussion is pretty interesting, and to me it's pretty straightforward, but apparently it's not straightforward out there in the world. So why don't you explain to these folks what's probably happening to them, or their relations, or their friends, those who have post-concussion syndrome.
Mm-hmm. This is a very important point, just because in some of my favorite neurology textbooks, the authors will talk about how individuals with post-concussion syndrome, they would in essence make fun of individuals like you, saying, you know, you'd been through seemingly trivial head trauma, because these are neurologists that are working in hospitals and they see patients literally who have fractured skulls, subdural hematomas, a variety of subarachnoid hemorrhages, very severe traumatic brain injuries. And then to see someone like yourself who just kind of dings your head, and I say that, you know, in quotes, and then your life changes and you have all of these symptoms. So that's kind of the framework that was set for then the NFL to come in the later 2000s to say, we do have an issue, there are problems going on in the brain for those who sustain multiple head impacts. And that really prompted the literature to start looking at post-concussion syndrome much more acutely, because before that, it was kind of this nebulous entity in the world of neuroscience. So in terms of what actually happens, to answer the question, for those of you who hit your head, there have been studies showing that individuals, when they have a head injury, their blood-brain barrier breaks down immediately. So the blood-brain barrier are your blood vessels that go into your brain, and they should be like a tight PVC pipe. That's the best way to think of them. And they should only allow small molecules such as glucose or oxygen to get through the blood-brain barrier. However, for those of you who have head injuries, what we're finding is that that blood-brain barrier becomes like Swiss cheese. And when it's like Swiss cheese, then immune inflammation from your body can actually start going into your brain, a place where it shouldn't be. You in essence have a separate immune system in your brain than you do in the rest of your body. But once the immune system from your body begins trafficking into your brain, it turns on the immune system in your brain to keep the inflammation going. We're finding this is one of the central components of post-concussion syndrome. Now, going even further, studies have shown that after head impacts, that stress hormones can go up 200 to 300% immediately following an injury. This is highly significant because now new data is saying that when these stress hormones go up, the gastrointestinal barrier begins to break down. Your gastrointestinal barrier is where 70% of your immune system is. And so now if your gastrointestinal barrier becomes, for all intents and purposes, like Swiss cheese, now molecules of food that you're eating that should be in your gut start getting outside your gut. And that can lead to
leaky gut, for those of you who are more informed on this matter.
It's a horrible term, but that's just what it's called. And so then the immune system gets flared against the gut, and that creates this sustained immune inflammatory model that's being postulated relative to post-concussion syndrome. They've done studies where they basically take mice, they hit them on the head, and they either inject them with pieces of bacteria that are commonly found in the gut, or they don't. And those that are injected with the pieces of bacteria develop this condition like post-concussion syndrome. So it's very, very, very interesting. And because of this, and we mentioned earlier in the broadcast how the skeptics, so to speak, will say, well, you're a post-concussion syndrome patient, but Joey over here had a surgery and he has the same symptoms as you. He has PTSD, he has brain fog, he's a little bit dizzy. Or someone else was in a trauma. They fell off a building, they did not hit their head, but they fractured their arms and they have the same symptoms as you. Why do you have post-concussion syndrome? And one of the new research articles that came out on this demonstrated specific inflammatory mediator abnormalities in PCS patients, post-concussion syndrome patients, that were different from surgical patients or infectious patients. So that's hugely important, because one of the reasons why we're doing this Cutting Through the BS broadcast is to bring you validity, that there is validity to your illness. But so many of you are not hearing about it because you have to be digging through the scientific literature to see it, because it's going to be 5 to 10 years before something really becomes commonly clinically employed. And so with that, just know that there's new research showing that there are immune system abnormalities in post-concussion syndrome patients, certain inflammatory profiles that they can test. Even a simple blood test like the C-reactive protein is now being looked at as a marker for post-concussion syndrome patients, that they're seeing as elevated versus non-post-concussion syndrome patients. So all of that is really, really important. And some of these immune system abnormalities that I'm talking about, they're cytokine abnormalities. Cytokine is a technical word that basically means an immune messenger. These are little immune cells. Think of our immune system as being our military. You have different branches in the military. You have the Air Force, you have the Marine Corps. Within the Air Force and the Marine Corps, you have generals, and then below them you have colonels. And you have the chain of command going all the way down. Well, down here, the grunts are kind of like the cytokines. And when we're in battle, so to speak, or there's inflammation, the cytokine profile can change. Certain ones can go up, certain ones can go down. And that's one way we're really figuring out the inflammatory profile of a post-concussion syndrome patient.
Yeah, so basically, you get injury to your brain breaks down your gut, and then your gut, in return, creates inflammation that goes to your brain on a variety of different levels. And so you have this vicious you have this vicious cycle, brain-gut axis, it has become to be called. And once that gets going, it's off to the races. And for those people who are skeptical of you, some people are just don't know. Some doctors aren't skeptical. They just don't know. And rather than say, we don't know, and they don't realize how much they hurt a patient by saying, why do you have this when that person does? They just don't know. Their whole world is, look, you didn't have a bad blood-brain bleed, you didn't have a subdural hematoma, you're not going to die on me. So, what you're just deal with what you're dealing with, and it can be very stressful. So one of the things that I want to bring out here is, and this is me, and it's a big deal to me, is the neurological exam. Okay, we do very thorough examinations, and there's a reason for that. A lot of people discard examinations. Dr. Gates mentioned further lab testing, and I think he might even talk about a little bit more, I don't know. But he talked about cytokines and inflammatory markers, but he talked about C-reactive protein. And in the end, most of the time, by the time we're done with the neurological part of the exam, which Dr. Gates performs, he pretty well has a good idea of what's going on relative to what part of the brain is affected and what part of the brain needs to be treated, which we're going to talk about in a few minutes. So I think it's important because I think most people don't get an exam. I don't think they really get an exam, especially if you go to the emergency room. It's pretty much, you have these symptoms, either go home and relax and hope they go away, or if it's severe enough, they'll do a CAT scan, EMG, as we talked about ad nauseum. Now, usually the patient shows up here, it's all normal. And now it's kind of like the patient's going, well, how do you find out what's wrong? Well, first you do a history, understanding that the patient may already be a compromised host, and some of those things may be perpetuating this, or that they've developed a vicious brain-gut barrier situation, vicious cycle, and you ask questions relative to that. All the things that can create inflammation in the brain. But that brain needs a little bit more than just dampening the inflammation to get better too. And so you need to figure out what parts of the brain are having a problem. There's some interesting new data. Now, by the way, I don't testify in court anymore, just for the record, okay? It's just not my thing to do anymore. It's divisive, it's combative, and it's not necessarily always like genuine as far as the insurance companies and stuff go. And but Dr. Gates has had the distinct honor of testifying in the past year. Not something that he wants to do, or maybe it is, I don't know. But he came up with some interesting understandings relative to some studies that predict some types of exam procedures that predict concussion type injuries. So maybe you want to share with them the nuances of the exam, because I think for us they're more important, or as important as anything.
Right.
As far as figuring out if the person has a concussion and where it is, and leading to treatment.
Yeah, in our model of healthcare that we have now, everything has become so simplistic, in that everybody just wants one test. You want one test for one. What's the test for fibromyalgia? What's the test for chronic fatigue? What's the test for post-concussion syndrome? What's the MRI finding? Well, in this world of post-concussion syndrome, it's so early relative to the imaging data. We don't have it yet, and I'm going to talk about that in a little bit. But that doesn't mean we don't have decades now of neuroscience literature showing what areas of the brain are involved with doing certain functions or certain eye movements. And eye movements is a major area of research and interest in the world of post-concussion syndrome. The reason why is one of the most well-researched aspects of brain function. So they know if you move your eyes quickly from the left to the right, from point A to point B, that executes or involves one area of your brain that's completely different if you're following a target that's moving like this from left to right. And it's different than if you have a bunch of dots or squares or trees moving past you. If you turn your head a certain way, look at your thumb, turn in your head, all these different things activate different parts of your brain. And by knowing that, we can test your eye movements to see what parts of your brain are working or not working. And so there was a wonderful article out of Canada. The doctor's name is Dr. Ellis, if I believe. He's a neurosurgeon, and he was working with pediatric sports-related concussion patients. And he went back to test which ones developed post-concussion syndrome, and he was doing eye movement testing with them. This eye movement testing is commonly used in the balance world, the dizziness world. Many of you have dizziness or balance issues. And it's used typically in ear, nose, and throat offices. But Dr. Ellis was using this with patients. And he found that those who had abnormalities with these eye movement tests, typically they're called vestibular eye movement tests, VOR testing, he found that there was a correlation to developing post-concussion syndrome. So simply meaning if you performed abnormally with these eye movements or you got nauseous while you're doing these eye movements on several of them, then your chances of developing post-concussion syndrome were that much more likely.
One of those pre-existing conditions that we talked about.
Right, or was an effect of the head injury. And so that's very, very important. In fact, my mentor just came out with an article this year where he was taking patients who had post-concussion syndrome for a long period of time. Usually if you have post-concussion syndrome for, let's say, a year, or especially 3 years now, your chances of recovery are much less likely, especially at the 3-year mark. That's been validated now. And he took patients who had long-standing post-concussion syndrome, did eye movement vestibular rehabilitation with them, and he had significant improvements. And so this is all throughout the vestibular literature now, the post-concussion syndrome literature. But when it comes to proving whether somebody had a head injury or not, lots of times the gold standard testing that's used is neuropsychological testing. So you're complaining of brain fog, and they want to check you and see, well, how fast can you think? Well, that is one measure. It's valid. It's one measure for validating post-concussion syndrome, but it is not the standalone measure for validating post-concussion syndrome. Validating post-concussion syndrome right now is based on a history, a thorough physical and neurological examination, and also involved in that workup include the eye movement tests, the video nystagmography is what it's termed, as well as neuropsychological testing. So that's really how post-concussion syndrome needs to be diagnosed in 2017 based on the literature. Going further into imaging, do I anticipate that in 5 to 10 years will we have an MRI test for concussion that is universally accepted and utilized throughout the country? I do. I do think that. I think that they're getting closer and closer. What you need to understand as a post-concussion syndrome patient is that you go to the ER and you get a CT scan, or you go back to the ER after having a CT scan, you get an MRI. And those tests are normal. But those tests are not sensitive for the microstructural changes in the brain seen with post-concussion syndrome. So those tests are looking, as Dr. Rutherford said, for bleeds, for fractures. You need a test that's going to look at how your nerve cells are functioning and how the wiring, so to speak, is handled in your brain. And that's where this new imaging modality called Diffusion Tensor imaging is going to be so important for post-concussion syndrome patients. There's a ton of data coming out right now using MRI diffusion tensor imaging. It's called DTI because there we can see the axons in your brain. Axons, think of those as the electrical cables that come out of the brain cell of the nerve cell, so to speak. And so with that, it's very important to look at the diffusion tensor imaging for patients who have post-concussion syndrome. Are there other modalities being looked at? Yes, there's bold functional magnetic resonance imaging, there's CT spectroscopy, there's all these different types of imaging modalities, but the MRI DTI is proving to be really the most valid, in my opinion. Mm-hmm. It's showing a lot of promise.
So that's kind of like the roundup at this point in time of what's going on. But now we have the patient sitting there, and they have all of these symptoms. The vast number of people who have come in here have been told. Some have been told they're going to have to live with it forever. Many have been told they need to see psychologists and they need to see counselors and things of that nature, implying that maybe they're just really stressed, and that's not the case. Usually by the time you've done a history and an exam that's appropriate for the condition, usually you can tell whether that patient's having a real problem or not. So the question that I'm sure is on everybody's mind is, do I have to live with this forever? Is it going to continue getting worse? Am I ever going to be able to like get it under control and go back to work or stop, having these sound sensitivities and things of that nature? And the answer is no, in most cases. Okay, and so there are procedures that we are functional medicine practitioners and a functional neurologist, and so we've married two disciplines to address the various aspects of what has to be done to get inflammatory responses calmed down, and also to rehabilitate the brain so that it starts functioning in a more normal fashion. Did you want to share some of that?
Yeah, absolutely. So what we use is a concept term neuroplasticity. And so through the concept of neuroplasticity is basically exercising your brain. If you exercise weak parts of your brain or damaged parts of your brain, can you rehabilitate them like you would a torn muscle, getting them working better again? And that's the concept that we use. It is coming out in the literature now using vestibular rehabilitation, which is a lot of these eye movement techniques that I talked about, not only for testing, but for rehabilitation, to strengthen the parts of your brain that have been damaged in the head injury. It's actually pretty point A to B. Think of it as personal training for your brain. But it has to be very specific. It's not generalized. The analogy would be if you go into the gym and you haven't worked out, why would you put 400 pounds on the bench press? You're going to tear muscles, you may fracture your ribs. Same concept for this issue. People who receive vestibular rehabilitation for post-concussion syndrome, it needs to be graded, it needs to be individualized and specific for that individual's condition. Now, in doing this, we've had success with that. However, our greatest success has come with marrying what Dr. Rutherford said, functional medicine principles, which include addressing the inflammatory components, looking at people's diets and how the gut breakdown is affecting parts of their brain and affecting inflammatory levels that are perpetuating this whole immune dysregulation cycle into the brain. So that's what we're looking at.
And looking at anything else that might be causing inflammation. To get your brain better, you need to get it rehabilitated so that it starts functioning right. From that perspective, anything that's causing inflammation in there needs to be evaluated. So you need to have proper blood sugar. As I briefly mentioned before, if you're diabetic or you have low blood sugar and you're not getting proper blood sugar in your brain, that's something that's important for the brain to have as a proper substrate so that it can get better. You need that proper oxygen to your brain. If you've developed a thyroid problem and it's not being taken care of properly, that affects brain function. That can alter inflammation in your brain, believe it or not, or decrease blood supply. And I could probably go on for quite a while.
Yeah.
We have a 22-page history that we have patients fill out. It helps. There's about 5 pages there that help to pre-localize the part of the brain that's probably being affected. But the rest of it is all about everything else that could possibly be creating an inflammatory response to the brain that needs to be addressed in that particular individual. And it's look, we can get 1,000 post-concussion syndrome patients in here, and every one of them will be a little different. So that's why the history has to be so thorough, because that is really what directs the physiological aspect of what's going on versus the neuroplasticity. But you're really shorting yourself if you're not addressing both of those at the same time. And we tried that years ago, and okay, we're just going to do the metabolic stuff with this person. Okay, we're just going to do the neuroplasticity, functional brain work with this person. And even Dr. Gates's mentor is finally starting to concede that both are a little bit better, from what I can understand, having one of our colleagues teach the physiology aspect of it. So that's really what you're looking for. We can't give you a specific pill or say something like that. We can tell you that inflammation is a part of it. We can tell you that some people are way more severe than other people who might do an inflammatory protocol and feel better, but most are not going to feel better. And really it requires a very thorough evaluation if you want to get it under control, and then understand how to keep it under control so that you can kind of go forward with your life again as though you were a normal human being again. So I think that kind of covers it.
It covers it, and there's much more. I mean, we could go on for hours about this. Hormonal testing can be abnormal in post-concussion syndrome patients. There's the whole topic of blood tests now. Beyond what I just said about inflammation, they're looking at using molecules like S100B as well as heart fatty acid binding protein. They're trying to look at all these different molecules that will predict whether or not you're going to get basically whether or not you need a CT scan. That's actually where the research is going. They're trying to figure out how they can cut down on costs for CT scans for patients who have mild traumatic brain injuries.
And pituitary brainstem stuff that they can throw off all your hormones and you're wondering why all of a sudden your periods have gone away and stuff like that after a concussion. That's all in those 22 pages though, some varying degree.
Yeah.
Yeah, we could go on for hours.
Yeah. So,
but we've been told not to
so
by
we'll limit it.
our producer and by you.
So if this is of something of interest to you, if this resonates with you, then you can go ahead and click on the link below for Power Health Consult to get scheduled for a consultation. We'll want to review all of your records in detail if this is something that you want to do, and we can guide you through the process as you click that link on Power Health Consult. So we really hope this was helpful for you. We're hoping to get the information out on post-concussion syndrome. We appreciate you watching through the entirety of the broadcast, and we look forward to seeing you soon.